Hey, I'm Anastasia. This is Anastasia's Hump Day Happenings. Wearing purple the whole month of October. Why? Because it is National Dental Hygiene Month. I am not seeing any dentists, by the way, who are appreciating or celebrating this. So I'm going to give you 10 things that your hygienist does, because it's not a cleaning. And without us being appreciated for it, no wonder you are thinking it's a cleaning. It's health and wellness. Okay, but before that, you want to win? Here's what you need to do. Like my Facebook page or subscribe here on YouTube to Hump Day Happenings and comment. One person will be selected at random to win an Oral-B Genius. That's $300, but I believe in you. And dental hygienists are not scary. We should not create anxiety. And you know what? We are basically your advocate for health. So let's go over some 10 things why. And we'll review what you can do to win an Oral-B Genius. Okay, number 1, blood pressure, and we also review your health history. So what does that have to do with anything? Habits, smoking, e-cigs, marijuana, joint replacements, do you have, diabetes? Have you ever had a stroke? Do you have heart disease? Other ailments, you have celiac disease, anything else? Have you been through chemotherapy, thyroid problems, anorexia, bulimia? Just so many things. Stress. You would be surprised at how that impacts your oral health. Number 2, medications. Because your medications, being over-the-counter or prescription, they contribute to oral health problems, being bad breath, dry mouth. And number 3, we connect them to develop also leading into number 4, nutrition. So nutrition, what are you drinking? What are you eating? What is it like? Do you have any food allergies? And going off on that, what's your sugar intake? Are there any hidden sugars you did not know about that are contributing to tooth decay? And oh, by the way, are you using xylitol? Or are you remineralizing your enamel? And what products would you know about? So for instance, basic bites, does anybody even know about that? That stuff is good stuff. 5, assessments. Here we go. Keep your arms and legs inside the entire time. We assess for risk caries, occlusion, abrasion, erosion, bruxism, gingival recession, dry mouth, hypersensitivity, gingivitis, gum disease, bad breath, oral abnormalities, oral cancer, and more. Number 6, we do saliva tests, bacterial tests that help us identify what is going on in your mouth, and we take radiographs and intraoral cameras. We can take impressions. Number 7, instruments. Please ask about these. What are you using? It should be ultrasonic instruments and hand instruments. And the hand instruments need to be sharp. So you might want to ask what kind are they, when were they replaced, that kind of thing, because it makes it easier for us to remove the tartar swiftly and without traumatizing the tissue as much. All right, number 8, the polish used. It's got to be the right grit, because if it isn't the right grit, then your aesthetics, your ceramic crowns, they're going to look like, okay, I think we all know that one. Number 9, we're going to review your home care. So toothpaste, mouth rinses, tongue scrapers, flossing options, and toothbrushes. It's really important because it's really a tailored home care treatment for you. It's not a one-size-fits-all, and let's just, leave it at that. It doesn't happen that way. And number 10, this is where we co-diagnose with the doctor. We're bringing it home for you and saying, okay, I've noticed this. There's active infection or active disease here, relaying it to the health history, relaying it to the medication, and this is what we can provide for you. Be genius. Comment. Ask me a question that maybe you didn't know that your hygienist can do, cannot do, or something you're interested in about your oral health. And one selection will be randomly picked to win an Oral-B Genius. Show us your purple love. You got a question? Ask it, of course. #AskAnastasia. Otherwise, till next Wednesday, take what you learn and make a difference with it.